All right, hello there, patients. So my name's Emily. I'm going to be your student physical therapist today. Can you confirm your name and date of birth for me?
John, 5/15/97.
All right, thank you very much. So today I'm just going to start off our evaluation with just a quick interview. I have a list of questions here that I want to get through, and you can answer them to the best of your ability.
Okay,
So to start off, what brings you in today?
so I'm just having a little bit of trouble, kind of just like walking around my house. I have some stairs in my home. Just a little bit of difficulty being able to do things I want to do, like basketball and playing cards. My arm right here is really tight, so it's kind of preventing me from doing some of those things.
Okay. So then, what caused you to have these difficulties?
So I had a traumatic brain injury 23 years ago, and that was basically like the start of all of this.
Okay. So thank you for that information. And then going back, you did mention that you had stairs in your home. So how many levels is your home?
So it's 2 stories, and sometimes it's just a little bit hard with my balance to go up and down them. I do live with my parents, and they're usually there to help me, but I'd like to be like really independent on my own.
Okay. And then just one last thing about the stairs. How many stairs do you have going up?
So I think it's about like 14 per flight. So
Okay. So then multiple flights, or just one?
just one, because
Just one?
2 stories, so just 14. Yeah.
Okay. And then now, so you've been mentioning that this has been going on for a while. It's affecting your ability to do things independently, affecting your balance, things like that. Are you on any medications?
Yeah, I'm on baclofen.
Baclofen? And do you know what that's for?
I'm having a hard time remembering right now. I'm not sure.
Okay. Was it more so for like your muscles maybe, since they're a little tight?
I now that you say that, I think it was for my muscles.
Okay.
That makes sense.
Does the word spasticity ring a bell, possibly?
I think I've heard that before.
Okay.
Yeah.
Okay, just wanted to double check. And then, how do you take this? Is it through injection or like with a pill?
It's just a pill.
A pill? Okay. And then how often do you take it?
I just take it once a day.
Once a day? All right, thank you. So then, the next question that I have is just going to be, you've been mentioning along the way you want to get better balance, want to be able to do things independently. Do you have any other goals that you want to achieve while we're in physical therapy?
I think my biggest goals are just getting back to doing everything really functionally. My arm has been limiting me and like kind of getting dressed, things like that. So I really just kind of want to get back to my normal ability of being able to go around my home and do things.
All right, sounds good. And before we continue on, I'm just going to ask a series of questions, and you can provide the answer of either yes or no after I ask it. So, as of recently, have you had any unexpected weight loss?
No.
Unexpected weight gain?
No.
Dizziness?
No.
Lightheadedness?
No.
Falls?
No.
Fatigue?
No.
Numbness or tingling?
No.
Muscle weakness?
A little bit sometimes.
Sometimes. Right. Joint swelling?
No.
Rashes?
No.
Shortness of breath?
No.
Coughing?
No.
Nausea?
No.
Vomiting?
No.
Loss of appetite?
No.
General uncomfortable feeling with your body?
No.
Weakness?
Yeah, a little bit.
Okay. Yeah, that one's a little repetitive, sorry. And then change in cognition, so like, your ability to remember things.
Yeah, it is hard for me to remember things sometimes.
Okay. And is that more so with like memories from a long time ago or like recent things that are going on in your life?
It's usually like recent things I'll have trouble remembering.
Okay. And then the next question, any pain that never changes?
No.
Joint stiffness?
Yeah, my arm over here, my left arm.
Any new moles?
No.
Chest pain?
No.
Heart palpitations?
No.
Sensitivity to hot?
No.
Sensitivity to cold?
No.
Difficulty going to the restroom?
No.
Depression?
No.
Any changes in vision?
No.
Balance?
Yeah.
And then any changes in hearing?
Yeah, it is a little bit hard for me to hear. My right ear is better.
Okay. Alright, I'll keep that in mind. Alright, so the next portion of this examination is just going to be testing some of your body's sensory systems. So if you'll go ahead and lay down on your back for me.
Okay.
Alright, thank you for that. So then the first one that we're going to be testing is going to be your light touch sensation. So I'm going to be using this cotton ball. Let me sit on this side. Oh, sorry. Oh, I forgot to take your vitals. Go ahead and sit back up for me. Just kidding. We have one more step. So what I'm going to do next is test your vitals before we continue on. Very important to make sure we're nice and healthy, at least in that department. So then the first thing I'm going to be assessing is going to be your blood pressure. I'm going to go ahead and put this cup around your arm. Yeah, I know we're a little tight here, so I'm going to try my best. Any discomfort?
It's okay.
Okay. Alright. Go ahead and set these in. Make sure we're ready to go here. And then I want you to try your best to relax your arm. I know it might be a little bit difficult, but that's okay.
Okay.
Just so I can palpate right here. That pulse. Alright. I'll go ahead and set this right here. And then you can go ahead and relax your arm and mine. Alright. And now here we go. Alright, so I got 102/68, so that is a normal reading for blood pressure. Go ahead and take this off now. And then the next thing I'm going to assess is just going to be your pulse, or I'm sorry, your oxidation levels in your blood. So I'll go ahead and use this hand. You can put your finger right there for me, and then it's just going to assess how much oxygen is in your blood. So we'll give that a moment. Alright, think in there. Okay, so your pulse, or I'm sorry, your oxidation levels are at 99, which is a normal reading, so that is good. And now the next thing I want to do is just assess your pulse now. So you can go ahead and relax your hand, and then I'm just going to take your pulse for about a minute. Alright, so I got a pulse of about 69 beats per minute, which is within the normal range. And then along the way, I was looking at your breaths per minute, and you got about 14 breaths within that minute, which is also within the normal range. Okay, so now you're able to lie on your back. And then we'll go ahead and start that sensory testing. So again, I'm going to be using this cotton ball, and I'm going to lightly apply some pressure with it in various regions of your arm. And what I would like you to do is just let me know whether you feel it. Okay. So if you feel it, you'll say yes. If you don't feel anything, you'll say no. Okay. And it should feel like this. Okay. All right, so if you go ahead and close your eyes for me.
Yes. 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 Yes.
All right, thank you. And now the next part is just going to be doing the same thing, but now on your left side. So again, just let me know whether or not you feel it. If you feel it, say yes. If you don't, say no.
Yes. Yes. Yes.
Thank you. And now the next part of this test is just going to be comparing both sides. So I'm going to lightly touch again with the cotton ball the both arms, and you'll let me know whether they feel the same or different.
Okay. Same. Same. Different, I think.
Different? Okay.
Different. 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 Different.
Okay. Thank you for that. And now the next part of this test, you can go ahead and open your eyes. I'm going to be doing testing a different sensation, which is supposed to differentiate between sharp and dull. So I'm going to be applying both of these sides. The sharp side will feel like this, and then the dull side will feel like this.
Okay.
So at least for the upper extremity for now, I'm going to do this sensation first before moving on to your legs. So you can go ahead and close your eyes again, and then let me know which side you think I'm using. So we'll start on the right side first.
Sharp. Sharp. Dull. Dull. Sharp. 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 Dull. Sharp.
All right, now I'm going to go ahead and go over to the left side.
Dull. Dull. Sharp. Dull. Dull. Sharp. Dull. Sharp. Dull. Sharp.
Okay, and now again, I want you to compare both sides. So I'm going to be touching with either sharp or dull on both arms, and you let me know whether it's the same or different.
Same. Same. Different. 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 Different.
Okay. And now we'll go ahead and do the same thing, but this time on your legs. So I'm going to start again on the right with the cotton, which, just to remind you, is going to feel like this. And I want you to tell me whether or not you feel it, yes or no.
Okay. Yes. 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 Yes.
Okay, and now I'm going to do it to your left leg. So again, let me know if you feel it, yes or no.
Yes. 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 Yes.
right. And now I'm going to do both legs again, so just let me know whether or not they feel the same.
Same. Same. Same. Different. 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 Different.
Okay. And now I'm going to go ahead and go back with the sharp dull. And just to remind you, it's going to feel like this. So here's the sharp side, and here's the dull side. So you let me know on your right leg whether or not you feel it.
Okay.
Or sharp or dull, I mean.
Okay. Sharp. Dull. Dull. Sharp. Dull. Dull. Sharp. Dull. Sharp. Dull.
All right, and now I'm going to go ahead and do it on your left side. So let me know whether it's sharp or dull.
Dull. Dull. Sharp. 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 Dull. Dull. Sharp. Dull. Sharp. Dull.
Okay, thank you. Okay, now the next part of our examination, you can go ahead and open your eyes now, is going to be just assessing your range of motion. So I'm just going to be moving your arms through various directions just to see how much motion you have available in them.
Okay.
So at least to start off with the right, we can just go ahead and have you do the motion. So if I can have you lift your arm up straight ahead. Okay, so within functional normal limits. And now if you'll go ahead and reach it up this way. Yep, within normal limits. Now if you'll go ahead and like bend your elbow up to your shoulder, straighten it out within normal limits. And now go ahead halfway, and now I want you to move it away from your body and now towards your body. Wonderful. Now we're gonna go to the wrist. So if you wanna go ahead and bend away, come in, okay. Make a fist, open up, fingers wide, fingers together. Okay, wonderful. And now we're just gonna do some motions on your leg now. So if you want to go ahead and bring your knee towards your chest for me. Okay, so that motion at the knee and hip are normal. And now if you'll go ahead and point your toes toward the door, point your toes towards your face, go ahead and point them again. And then now I want you to point them inward. And now outward. Okay, wonderful. So all of those were within normal limits. So now I'm going to go ahead and assess your left arm. So I remember you mentioning that it was feeling a little tight here. So I just want to assess how much range of motion we have available, okay?
Okay.
So if I can have you relax as much as possible, I'm going to move your arm through the motions that we did on the other side.
Okay.
So first I'm going to lift it up. So that's within functional limits. Now I'll go ahead and lift it up to the side. So again, within functional limits. What I want to do is try to straighten your elbow out. Okay. Alright, so it seems to be the end range here. I was noticing some spasticity along the way. So according to a scale that we use to test or provide a measurement for that type of tone, which is called a modified Ashworth scale, probably give that about a 3 for your biceps. And now what I want to do is just measure this range of motion so that way we can track it better for later on in the treatment, see how much progress we can get. So I'll go ahead and measure the starting position. Switch that around. Okay, so I'm getting about 145 degrees of flexion. So now again, I'm just going to straighten it out. Try to relax as much as you can. Alright, so I was able to get that to about 37 degrees. So you're lacking a little bit of extension there, which I think is what you were mentioning in terms of, you know, having difficulty doing those functional things. Okay, and now what I want to do is just test here at the wrist, see how much motion we have here. Alright. Okay, now I want to try to open up here a little bit. Alright, noticing some resistance with that motion. Okay, let me try and open up your fingers now. Yep, so noticing some resistance there as well. Not as bad as the biceps. According to that scale, I'd probably give that like a 2. Now we'll go ahead and move the thumb a little bit. Yep, just a little bit of resistance, but not as bad. Yep, in both of those directions, I'd probably give that like a 1+. And then I just want to measure the resistance that I felt here at your wrist. So what I want you to do is try to open up your wrist as much as you can so that way your palm is facing the ceiling. So as far as you can go. Alright, so I got about 7 degrees there for that motion. I'll go ahead and document that. Alright, so now that that motion is done, the next thing that I want to assess is going to be some strength. So let's go ahead and start that. So if I can have you sit back up for me. All right, thank you. So then I'm just going to assess your strength just very grossly, just very, you know, like, I guess, holistically. So first I'm going to go ahead and test your right side. So if I can have you lift your arm up this way for me. Don't let me move you. Okay. And now go ahead and lift your shoulder up to your ear for me. Don't let me move you. Okay. Now we'll go ahead and lift the arm up this way. Don't let me move you. All right. Now we're going to go ahead and bring your elbow towards your shoulder. Don't let me move you. Now we're going to switch. Don't let me move you. Okay, elbow at your side. Don't let me move you. Not this way again. Don't let me move you. All right, and then now specifically at your wrist, so we'll go ahead and point towards you, the fingers, and then don't let me move you. Now go ahead this way, and then don't let me move you. Okay. And now just your fingers real quick, so don't let me uncurl them.
Okay.
All right. And now I'm just gonna go ahead and assess your right leg as well. So if I can have you lift your thigh off of the table for me. Okay, and then don't let me move you. Okay. And then now I'm just gonna assess how much flexion you have available. So then don't let me bring your foot closer to the table. And then don't let me move your leg away from the table. So try to keep it close. Don't let me move you. Okay. And then go ahead and point your toes up to the sky. Don't let me move you. Point your toes down to the floor. Don't let me move you. So I'm going to go ahead and assess the other side. So at least for your arm today, probably won't be assessing that strength since we were limited in some motion there. So I'll probably assess the strength of that arm later on in treatment, but at least I'll try to get an idea of how much strength you have available in your leg.
Okay.
So if you go ahead and lift this thigh up off the table for me, don't let me move you. All right. Now if you'll go ahead and straighten your knee for me. And then don't let me bring your knee close to the table. So don't let me move you. All right. And then now I'm going to apply some pressure this way. Don't let me move you. Now point those toes up. Don't let me move them down. And then now point the toes down. Don't let me move them up. Okay. So I did notice at least just a little bit of weakness, at least in comparison to the right side. So that's something that I will keep in mind. And then what I want to assess next is just going to be some reflexes. So I'm going to go ahead and get my reflex hammer. So I'm going to be assessing your biceps, triceps, muscle that I think has a cool name, brachioradialis, and then obviously your knee, and then some tendons down at your foot. So we'll go ahead and start with your right side. So go ahead and relax that arm in mine. Go ahead and look away. Wow. Very good reflexes. Okay. Now go ahead and push up into my hand. All right, now you can go ahead and relax it. All right. And then I'll go ahead and assess your right or your left arm, I'm sorry. So go ahead and try to relax as much as you can. Let me see if I can get some access to the elbow here for that biceps tendon. Okay. Now go ahead and do your triceps, as much motion as you have available for me. Wonderful. Now you can go ahead and push up into my hand again. Thank you. Now you can go ahead and relax. All right, now I'll go ahead and move to your leg. So I'll go ahead and start on this side. So you can go ahead and look away. All right, normal there. I'm gonna come down here. If you'll point down to the ground for me. Thank you. And now you can go ahead and relax in my hand. All right, one more over here. Okay. And now again, I'll do the knee. Ah,
That's a good one.
yeah, that was a good one. And now 2 more down here. That one was normal. That one was normal. All right. And then just a couple more measurements here, or assessments. So I'm just going to move your wrist really quickly.
Okay.
Just a quick motion. All right. Now I'll go over here. Quick motion. Now I'll assess at the feet. And what I'm assessing for is something that we call clonus. And now last one, your left. Okay, so I did notice some clonus here. So clonus is when your foot or your hand beats into my hand when I do that quick motion. So I counted about 3 beats with that.
Okay.
And then last thing is going to be a reflex that we call Babinski. So I'm just going to take this reflex hammer, this side of it, and I'm going to draw a 7 on the bottom of your foot.
Okay.
Now on the left. Okay, and those were normal responses. So the next part of this examination is just going to be assessing your balance. Since you did mention earlier that you feel as though your balance has been a little bit off and affecting the way that you're able to do things independently. So one of the first tests that I want to check out is going to be how long you can stand on one leg.
Okay.
So the goal here is to stand on one leg and try not to reach for the table.
All right.
However, if you do feel like you're going to lose your balance, you can go ahead and do that. But if you feel like you're about to fall, you can go ahead and bring the other foot down.
Okay.
And during this, I will provide, I will be holding onto the gait belt, but I won't be providing like any more assistance unless you need it.
Okay.
All right, so whenever you're ready, you're going to go ahead and stand on your right leg, and then we'll see how long that goes. So 3, 2, 1. Alright. Okay. Whenever you're ready. Okay, so that was about 11 seconds. So we'll go ahead and do this 2 more times for 3 trials.
Okay.
So whenever, oh well, I'll count down. So 3, 2, 1, go. Alright. I got you. Okay, so that one was 9. And now just one more time. 3, 2, 1, go. Okay, so that one was 7. So I'll go ahead and write that down to average it later. Alright. So now we're going to go ahead and do the other side. So now what I want you to do is to stand on this left leg. And again, if you ever feel like you're going to lose your balance, you can go ahead and touch the other foot to the ground. So 3, 2, 1. Okay, so that was
hard. That was hard.
Yeah, no, I figured it would be, but that's okay. That's something that we can work on. So for that trial, I got about 2 seconds. And now we'll go ahead and do the second one.
Okay.
So 3, 2, 1, go. All right, so that was about 2 seconds again. And now just the last trial.
Okay.
3, 2, 1, go. All right, so that was about 3 seconds there.
Okay.
So let me go ahead and write those numbers down. So now the next part of our examination is going to be assessing the way that your ability to walk and talk at the same time. So we're adding that cognitive component to see if that affects your balance in any way. So the first part of this test is going to be walking down this hallway down to the gap, or the corner, as you can see on the left, walking all the way back, because that'll be about 20 feet both ways. And what I want you to do during that is recite the alphabet as you normally would. So A, B, C, D, etc. And then I'll be telling you as we do this first part. And I'll be holding onto your gait belt during, just in case you need assistance. And I'll be standing on your right side so that way in case you fall, I pull you towards your unaffected side. Okay. On 3, 2, 1, go. A, B, C, D, E, F, G, H, I, J, K, L, M, N, O, P, Q, R, S, T, U, W, X, Y, and Z. A, B, C, D, E, F, G, H, I, J, K, L, M, N, O, P, Q, R, S. Okay, so that was about 22 seconds there. So that's a little bit over the cutoff, but nothing too serious, so it may indicate that you're fall risk. But based on how I saw you walk into the clinic, it seems like you're able to ambulate independently for the most part, but I guess that cognitive part may be adding a little bit of difficulty. So now for the second part, what I'm going to be doing is the same thing. So we're going to walk down to that corner and back, and you'll be reciting the alphabet again. This time, you'll be skipping every other letter. So the goal here is to recite like A, C, E, etc. So try to skip one letter.
Okay.
All right, so on your mark. Ready, set, and go.
A, C, E, G, I, K, M, P, Q, S, V.
All right, so this time it was about 30 seconds, so that's within the normal limits, at least for this part, which, you know, again, just shows that with a little bit of that cognitive component, it starts to affect your balance in terms of your ability to walk. So now to end this examination, I'll just provide the P2 diagnosis as well as the prognosis. So the patient is a 47-year-old male with a history of a traumatic brain injury 23 years ago and complains of poor left upper extremity function and impaired balance. Patient presents as well with impaired posture, limited left hemibody range of motion, impaired balance, impaired left hemibody sensation, increased tone on the left hemibody, as well as short-term memory loss and decreased left lower extremity strength. These limitations are preventing the patient from being able to complete daily functional activities as well as social activities such as ability to play cards and basketball. The patient requires PT intervention to improve posture, range of motion, balance, sensation, tone, and strength. Without physical therapy, the patient's symptoms could worsen, causing him decreased mobility and preventing him from being able to independently ambulate and or perform ADLs and IDLs. So thank you for your participation today, John. So based on the examination, something that I do want to focus on as we continue on with treatment is going to be, improving your posture, because, we're a little bit more rounded in the shoulders here. And then I noticed that your head is just sitting a little bit more forward than normal. So that's something that I want to work on. And as we noticed, you had some decreased strength of your left lower extremity, so we want to work on that. And most importantly, your balance, especially with adding that cognitive component, because that seems to be one of the regions where you could use some improvement, so we'll definitely be working on that in order to help you ambulate independently in your home, up the stairs, and hopefully get you back to playing some basketball and cards. So what I want to do is probably have you come in about 3 times a week for approximately 4 months to work on all these things, you know, bit by bit, and hopefully we'll start to see some improvements. So do you have any questions for me before ending our session today?
I think I'm all good. Thank you.
All right, no, thank you for your participation.